Vous allez entendre aussi un message enregistré qui dit que la conférence a été enregistrée. Donc, dès que vous avez entendu le message, là, vous allez pouvoir définitivement commencer à parler. Donc, je transfère à l'instant.
Merci.
This conference is being recorded. Cette conférence est enregistrée.
Hello everyone, bonjour à tous. Welcome and thank you for participating in today's update on COVID-19. Today, bienvenue à la mise à jour.
Welcome to today's update on COVID-19 in Canada.
Remarks from Dr. Theresa Tam, Dr. Howard New, and Brigadier General Krista Brody from the Public Health Agency of Canada. They will be accompanied by Joël Paquette from Public Services and Procurement Canada to answer questions. Aujourd'hui, nous entendrons des allocutions de Theresa Tam, du Dr. Howard New et de Brigadier Général Krista Brody de l'Agence de la santé publique du Canada. Ils seront accompagnés par Joël Paquette de Services publics et Approvisionnement Canada pour la période de questions. Following the remarks, we will open the teleconference line for questions from the media. Suite à la présentation, nous répondrons à vos questions. If you wish to ask a question, please press star 1 on your phone. Si vous désirez poser une question, veuillez appuyer sur étoile 1. Procédons à la séance. Let's begin. Over to you, Dr. Tam.
Bonjour à toutes et
Good morning, everyone.
we continue to make good progress with all 7-day rolling averages steadily declining. The average national case count has dropped more than 80% since the peak of the third wave to under 1,550 cases reported daily. Likewise, the average number of people with COVID-19 being treated in our hospitals each day has dropped almost 60% since the peak to less than 1,850 daily. Of these, on average, less than 800 were being treated in intensive care units, which is down more than 45% from the peak. And average daily deaths are down 40% to 31 deaths being reported daily. As of today, over 27.7 million doses of vaccine have been administered across Canada, with over 2.6 million doses of COVID-19 vaccines given in the past week. As of June 4th, 70% of the eligible population aged 12 years or older have received at least one dose of COVID-19 vaccine, and 9% have received 2 doses. Notably, Indigenous communities and the territories continue to have some of the highest vaccination coverage rates in the country. For example, as of June 7th, over 72% of people 12 years or older living on reserve have received at least one dose of vaccine. In the territories, 71% of the population 12 years older have received at least one dose, and 60% are fully vaccinated. As Canada steps into the vaccination fast lane, there is a lot for us to take pride in. In particular, despite the long, difficult haul of this pandemic, Canadians have continued to show kindness and creativity in supporting others, including building vaccine confidence. 20 finalists announced earlier this week as part of the Vaccine Community Innovation Challenge exemplify the many community-based initiatives that are doing this great work. The challenge called for innovative, community-driven proposals to help strengthen COVID-19 vaccine confidence in Canada and reinforce public health measures. Specifically, these projects encourage individuals and organizations to extend the reach to community members using different languages and culturally appropriate ways to convey the importance of getting vaccinated against COVID-19. One example of a finalist is an Indigenous community project that will use humor to reach its tight-knit, semi-remote community. The finalists will each receive a grant to develop and implement their unique campaign initiatives in communities across Canada. Let's keep working together, steady on the path to get back to the things we miss safer and sooner. Thank you. Merci. Miigwech.
Bonjour à toutes et à tous.
Hello, everyone. Nationally, we continue to make good progress, with all 7-day rolling averages steadily declining. The average national case count has dropped more than 80% since the peak of the third wave to under 1,550 cases reported daily. Likewise, the average number of people with COVID-19 being treated in our hospitals each day has dropped almost 60% since the peak, to less than 1,850 daily. Of these, on average, fewer than 800 were being treated in intensive care units, which is down more than 45% from the peak. And average daily deaths are down 40% to 31 deaths being reported daily. As of today, over 27.7 million doses have been administered across Canada, with over 2.6 million doses of COVID-19 vaccines given in the past week. As of June 4th, 70% of the eligible population aged 12 years or older have received at least one dose of COVID-19 vaccine, and 9% have received 2 doses. Notably, Indigenous communities and the territories continue to have some of the highest vaccination coverage rates in the country. For example, as of June 7th, over 72% of people 12 years or older living on reserve have received at least one dose of COVID-19 vaccine. In the territories, 71% of the population 12 years or older have received at least one dose, and 60% are fully vaccinated. As Canada steps into the vaccination fast lane, there is a lot for us to take pride in. In particular, despite the long, difficult haul of this pandemic, Canadians have continued to show kindness and creativity in supporting others, including building vaccine confidence. 20 finalists announced earlier this week as part of the Vaccine Community Innovation Challenge exemplify the many community-based initiatives that are doing this great work. The challenge called for innovative, community-driven proposals to help strengthen COVID-19 vaccine confidence in Canada, as well as reinforce public health measures. Specifically, these projects encourage individuals and organizations to extend the reach to community members using different languages and culturally appropriate ways to convey the importance of getting vaccinated against COVID-19. One example of a finalist is an Indigenous community project who will use humor to reach its tight-knit, semi-remote community. The finalists will each receive a grant to develop and implement their unique campaign initiatives in communities across Canada. Let's keep working together, steady on the path, to get things back to the things we miss safer and sooner. Thank you.
This week, we are completing the deliveries of vaccines to the territories. This means the Northwest Territories, Nunavut, and Yukon will have the vaccine supply needed to fully vaccinate their eligible population, 12 years of age and up. This achievement is a significant milestone in Canada's COVID-19 vaccine distribution strategy. In consultation with federal, provincial, territorial, and Indigenous partners, a decision to prioritize the North was made at the outset to support vulnerable populations in isolated communities with limited access to healthcare services. I want to thank everyone who has been involved in the distribution process since the start. We will continue our work until there are enough vaccines for Canadians to be fully vaccinated in the greatest possible numbers. To date, we have delivered close to 32 million doses of COVID-19 vaccines across Canada. The delivery of 2.4 million doses of Pfizer-BioNTech was completed earlier this week, along with ongoing deliveries of nearly 100,000 doses of Moderna. As announced earlier this week, we are tracking to distribute 7 million doses of Moderna by the end of the month. These shipments will be coming from the United States, and we are working to finalize regulatory and logistical arrangements in the coming days. We expect a shipment of 2.9 million to arrive in Canada on June 16th for distribution commencing the following day. We are anticipating a further shipment of 4.2 million to arrive the 18th of June for distribution the week of 21st June. Our distribution tempo keeps on increasing, with more than 40 million doses scheduled by the end of June and solid supply throughout the summer. Cette semaine, nous complétons toutes.
This week, we are completing the deliveries of vaccines to the territories. This means the Northwest Territories, Nunavut, and Yukon are receiving the vaccine supply needed to fully vaccinate their eligible population, 12 years of age and older. This achievement is a significant milestone in Canada's COVID-19 vaccine distribution strategy. In consultation with federal, provincial, territorial, and Indigenous partners, a decision to prioritize the North was made at the outset in order to support vulnerable populations in isolated communities with limited access to healthcare services. I want to thank everyone who has been involved in the distribution process since the start. We will continue our work until there are enough vaccines for Canadians to be fully vaccinated in the greatest possible numbers. To date, we have delivered close to 32 million doses of COVID-19 vaccines across the country. The delivery of 2.4 million doses of Pfizer-BioNTech was completed earlier this week, along with ongoing deliveries of nearly 100,000 doses of Moderna. As announced earlier this week, we are tracking to distribute 7 million doses of Moderna by the end of the month. These shipments will be coming from the United States, and we are working to finalize regulatory and logistical arrangements in the coming days. We expect shipment of 2.9 million to arrive in Canada on June 16th for distribution commencing the following day. We are anticipating a further shipment of 4.2 million to arrive June 18th for distribution the week of June 21st. Our distribution tempo keeps on increasing, with more than 40 million doses scheduled by the end of June and solid supply throughout the summer. Thank you.
We will now open the phone lines to questions. We ask that you limit yourself to one question and only one follow-up. We will be taking your questions in both official languages. Nous vous demandons de vous limiter à une question et seulement une question suivie. Vous pouvez poser vos questions dans l'une ou l'autre des langues officielles. We will start with the first question. Première question, opérateur.
Thank you. Merci. Our first question, la première question, Marieke Walsh de Globe and Mail. Your line is open. À vous la parole.
Good afternoon. I'm wondering if Madame Paquette, I think, could give us an update on what is happening with the delivery schedules for AstraZeneca and Johnson & Johnson. I know Johnson & Johnson still is going to have a statement out today on the decision from the FDA and Health Canada, but if you could just give us an understanding of the doses we're still expecting from them this month. It was my understanding we're supposed to get another 1 million from AstraZeneca, as well as outstanding amounts from COVAX and the Serum Institute. So if you could just give us an understanding of where those things stand.
Thank you for the question. So on COVAX, we do not have the detailed information on the next shipment. On the Serum Institute of India, at this time, that is still on hold, given, although the situation is getting better in India, there is still a hold on the vaccines coming from that particular supplier. And AstraZeneca, on our 20 million advance purchase agreement, the first shipment is due the week of the 28th of June of 1 million. I can let General Brody provide a little bit more detail on that. On the Johnson & Johnson vaccine, we have the 310,000 that came earlier. That is still on hold pending Health Canada approval. And they have advised that they will have a shipment at the end of this month, but further detail will be provided once we solidify that. So, General Brody, I don't know if there was anything else that could be said.
Thank you. I can add that we're working very closely with the provinces to determine their requirements, both for AstraZeneca and for Janssen, as they continue to support their vaccine campaigns, and look forward to being able to provide an update in the coming weeks as we refine those requirements against the arrangements that Joelle discussed. Thank you.
Okay, thank you for that. Just following up on that, the Health Committee was told, I believe, a few weeks ago that there would be a shipment from COVAX this month. So is that now in doubt? And how much specifically is expected in the next J&J shipment this month?
So as I said, the COVAX shipment, we get that information very close. It's a little different than our APAs in how we manage that information, because we receive it very close to the time of the shipment. So unfortunately, I can't give you any additional detail on that particular COVAX shipment that is expected in the month of June. On the Janssen or Johnson & Johnson vaccine, they have informed that they're looking at around the 300,000 at the end of this month. But again, we're working with the Public Health Agency and the provinces and territories on the next steps. Thank you.
Merci beaucoup. Prochaine question.
Next question.
La prochaine question, Christian Noël, Radio-Canada. Your line is open.
Next question is from Radio-Canada. Please go ahead. Question. Thank you for taking our questions. I was wondering about the deliveries. Coming from the United States, what can you tell us about the logistics? If you're talking about the comments that were made by the American government, we continue to work with the government on as to the possibility of receiving more doses here in Canada. When we do have more details as to the number of doses and the kind of vaccines, we'll be able to give you more information. Thank you.
Merci.
Thank you. If we look at the fact that territories will have received all of their doses already, I wondered at which point it became a significant development for the North, given the priority we granted the North. And then what about the projections? If we look at the rate of vaccination, it seems that the province's goals will be met even before September. So how is that significant?
C'est Dr. New.
Answer. This is Dr. New. Perhaps I can begin to answer the question as to the vaccine coverage. As we say, it's always been a goal to have 75% of the population vaccinated with both, fully vaccinated, that is, with both doses. We've already seen that in the territories, things are going very well with their vaccination program. I believe that 71% of all eligible people age 12 and older have received a dose, and 60% are fully vaccinated. But I think that even with the goal of 75%, why not more? Why not aim higher? So we will continue to work closely with the public health authorities in the territories and the provinces as well, of course. And once we have reached the goal of 75% of the population fully vaccinated, we will continue to work, as we've said previously, in order to vaccinate the greatest number of eligible Canadians possible so that we can vaccinate. Why not aim for 80%, maybe even 100% if possible? It's always something we can attempt and something to follow. But as for the territories, we are certainly well on the way.
J'aimerais juste ajouter.
Supplementary answer. I would like to add, we just want to ensure that doses are delivered in Canada as quickly as possible. And as the vaccines continue to arrive in Canada, and they are doing so regularly, so I can tell you that we're well on our way to have sufficient supply to meet our goals of vaccinating all eligible Canadians by the end of September. So we continue to aim for that goal. Thank you.
On avait une stratégie.
We had a strategy, and we have reached that strategy. So the territories have all the doses they need after this week's deliveries in order to fulfill their vaccination program, including the second dose. So it really is a good time for the vaccination program, both in the north, but also for the whole country. Thank you very much.
Thank you. Merci. Our next question, la prochaine question, Mia Rabson, the Canadian Press. Your line is open. À vous la parole.
Hi, Dr. Neal. Just wondering if you could build on your last answer a little bit where you said, why not aim higher than 75%? And I'm wondering what data we have at this point on what the barriers are to beyond that. Do we know sort of where there are pockets of hesitancy, and what are we doing to try and address that?
Okay, thank you, Mia, for the question. I'm sure Dr. Tammy chip in as well, but you're right. When we gave our presentation, I think a few weeks ago with the modeling, I think a lot of people were fixated on the so-called 75% one dose and then 20% with two doses as an indicator for potential, I should say, loosening public health measures. We've also indicated that it's not just the vaccine coverage, but it's also linked to obviously what's happening in the community and also what the impact is on the healthcare system. If all the indicators are trending in the right direction, then certainly, provinces, territories, and which are doing right now, can open up, more and more. So that's, I think, what everyone's hopeful for the summer. But in terms of vaccine coverage, I think the more people that are covered, the harder it is for the virus to continue to sort of propagate and spread throughout the population, because there's more, I would say, collective immunity, herd immunity. So I think that's something we're very alive to, because we do recognize that no vaccine is 100% effective. So really, I think it's an artificial target in some ways, and we're trying to, as we've always said, vaccinate as many eligible Canadians as quickly as possible, and we're aiming obviously towards the end of the summer with what we're seeing in terms of the regular schedules of arrival of vaccines and the administration by provinces and territories. Based on what we're seeing around the world, certainly the experts are still discussing what might be sort of at least that minimum or optimal sort of herd immunity, and it's somewhere 70-75%. But especially now with the I think the emergence of variants, including Delta variant, I think it just underlines the point that it's so important for everyone to realize that one dose doesn't do it. You really need to be fully vaccinated, especially with the vaccine requiring two doses, to get those two doses, so that all of us are in a much better position of being protected against COVID-19. With respect to vaccine hesitancy, I would say that yes, in some ways it's always easier to get the first 50, 60, maybe 70% even of the population covered, but we do recognize that with respect to vaccine hesitancy, that's been an issue that's been around even before COVID-19. We recognize that certain subpopulations, it might be a matter of access, and certainly we're looking at all of the different types of barriers to access, and maybe maybe a lack of information that could be at play, and therefore we're looking hard at how we address that. As we just mentioned in our opening remarks, certainly we have a very innovative approach in terms of funding projects at the community level, so that really it's peers talking to peers, and within certain groups culturally and so on, that hopefully will also increase what we call vaccine confidence. So all of those things I think are in play. But always where we keep looking at the issue and with our provincial territorial counterparts, recognizing that there's still maybe some pockets. What more could we be doing in terms of reaching at those individuals? We're looking at social media platforms, all sorts of communication channels, but it's more than that. It's leadership. It's trusted leaders in certain communities also going forward and showing that they've been vaccinated, that they feel confident about why it's important to them and their families and their community. And hopefully, like I say, what we're seeing is a snowball effect. And I think as more and more Canadians get vaccinated, even with the 2 doses, I think it just increases the confidence overall. So I think it's all in the right direction.
Thank you. And I'm also wondering, Dr. Tam or anyone else, if you could weigh in a little bit on the debates that seem to be happening at the provincial level about when to give a second dose to people who got AstraZeneca. It seems to be all over the place depending on what province you're in. Ontario saying it has to be 12 weeks. Other provinces saying you can get it sooner if you opt for a second dose of AstraZeneca instead of mRNA. Just wondering if NACI has been asked to weigh in on this, and if you have any guidance for people as to what is actually best and what the data actually says about when that second dose should be given.
Yeah, so the National Advisory Committee on Immunization provided a number of different recommendations. Obviously, different intervals were looked at during clinical trials, and many of them were quite short. And then we had to rely on the millions of people that got vaccinated post regulatory authorization to look at vaccine effectiveness. But I have to preface this by saying that people haven't studied every single interval. So the data is not available for, every week, looking at each incremental week what the vaccine effectiveness is. What I can say is, first of all, there is a minimum interval. So that is actually quite critical, and they are slightly different for the different vaccines. So you shouldn't get the 2 doses too close together. So for Pfizer is 19 days, for Moderna is 21, and for AstraZeneca is 28. Don't go below that, because that can actually affect your priming and boosting interval, and that is something that people just have to be aware of. You can be kind of overly fast, if you like, or overly enthusiastic about getting that second dose. So keep that minimum interval. And then really what NACI said was up to 16 weeks. But if the supply is available, you can shorten that interval. And if obviously, if you have a Delta variant that is circulating in your community, then getting that second dose in is really important. And some provinces have looked at maybe homing in on some of the areas with higher incidence with that second dose faster. So it depends on local epidemiology. One vaccine that there is some information on is AstraZeneca. AstraZeneca seems to be more effective if you increase that interval from the baseline of 4 weeks to 12 weeks. So there's some data on that. But there's no data really from 8 weeks to 10 weeks to 12 weeks. It's a matter of balance of looking at, again, what your epidemiology in terms of trying to shorten that interval, and supply and other factors. So that's why there's some variation. But I think many provinces are going somewhere between the 8 to 12 week mark for the AstraZeneca vaccine. But you would have to discuss with the local authorities. But so just remember this minimum interval, don't go below that. And then it's up to 16 weeks, but anywhere in between, there is not a massive amount of information on.
Thank you. Next question. Prochaine question.
Thank you. La prochaine question, our next question, Estelle Côté-Sroka, Radio-Canada.
Next question, Radio-Canada. Please go ahead. Question. Hello. I'd like to get some information about the eventual sharing of vaccines with other countries. What criteria will be used here in Canada in terms of vaccination, hospitalization, in order to find ourselves in a place where we as a country will be ready to share and give our own doses of vaccines to other countries?
Merci pour la question.
Answer. Thank you for the question. I understand that there will be more details with respect to vaccine donations that will soon be announced. So I cannot provide the information you're seeking at this time. It's just been announced and work is still being done to provide more information. Thank you.
C'est Dr. New, peut-être.
This is Dr. New. Perhaps I could add some comments. Well, of course, the priority remains vaccinating Canadians with both doses to all Canadians who want it. So that's where we're beginning our planning, logistics, supply. Those all remain a priority for us. But of course, given the contracts, there are many, many more doses available. And others will be making decisions about sharing and how. But I do believe we have already offered up 1 million doses for other countries. But naturally, it's very important to first have enough doses here in the country for Canadians. Thank you. Follow-up question. Perhaps I'll ask a supplementary question. When will we know how many doses Canada will send abroad? And to come back to my first question, maybe it wasn't clear, but I wanted to know in terms of scientific criteria, when will we be able to give the go-ahead for sharing doses with other countries who don't have any or not, or who don't have enough? If you could please answer that question. Thank you. Answer. As for the number, I believe we said 100 million doses will be given. And that's what I meant when I said there'd be more details coming. But in terms of scientific criteria, I'm not in a position to answer that question.
C'est Dr. New.
This is Dr. New speaking. As we've previously said, we're always offering both doses of vaccines to any Canadian who wants them. I think we're very well positioned to have finished that by the end of the summer.
Merci.
Thank you.
Next question.
Thank you. Merci. La prochaine question, next question, Annie Bergeron, Oliver, APTN National News. Your line is open. À vous la parole.
Hi, thank you very much for taking my question. I'm just going to follow up on what one of my colleagues mentioned about the interval for AstraZeneca. As I understand it, that longer interval based on the studies is best for a first and second dose of AstraZeneca. But a lot of people are now deciding that since it's allowed through NACI to switch to a Pfizer and Moderna. So given that the Delta variant is spreading, do you believe that Ontario should be shortening that timeline down from 12 weeks Because right now, if you live in a hotspot like Toronto, you have Moderna or Pfizer, you're eligible for a second dose much faster. Those with AstraZeneca in those hotspots are still waiting a minimum of 12 weeks.
I can't comment on the details in Ontario, but I know that many jurisdictions are working between 8 to 10 weeks for their second doses. Some have harmonized that interval so that it doesn't matter which second dose you're getting. That's roughly the interval for the appointments. In terms of the actual technical information available on the mixed dose schedule is limited. In the study from Germany, when they looked at the AstraZeneca followed by an mRNA vaccine, they did it at just over a 10-week interval. So I think from a sort of expert opinion perspective, the chief medical officers across the country have thought that somewhere between that 8 to 10 week interval is probably something that they will be working with. But I think Ontario is a very big province. We have to sort of let them talk to you about why they're doing different intervals in different places.
Okay, thank you. And as my follow-up, some countries are looking at doing just one dose of a COVID vaccine for children and teens. Is this something that Canada is considering as well?
Well, I know that the National Advisory Committee on Immunization is looking at and following the data on all of this evolving information. I think, of course, one of the reasons is for the 12-year and up, which is the vaccine that's authorized at the moment, but also for the younger people, the younger kids that for which the clinical trials are ongoing. So I think one of the developing, I guess, evolution in the observation is one of the side effects that following immunization people are tracking now is the myocarditis or heart inflammation that's occurring at generally after the second dose in younger people. A few days after they've had their second dose. So while essentially people seem to be recovering from these fairly quickly, these events, it is something to be watching for. There is no specific recommendation to just go with one dose right now, and the regulator has not made any changes, but I know that they're all following this information very closely. For the younger kids, I think there's clinical trials using lower doses as well. So we'll have to also see what happens in those trials, and there's no specific recommendations for the younger kids at the moment.
Thank you. Prochaine question. Next question.
Thank you. Merci. La prochaine question, our next question, Ryan Tumulty, National Post. Your line is open. À vous la parole.
Yeah, I'm wondering if you can offer any greater clarity about the 300,000 doses of the Johnson & Johnson vaccine that Canada has basically in storage while we're waiting for this FDA review. The reports coming out of the U.S. today are that the FDA is calling for a lot of those doses that came out of that plant to be scrapped. I'm wondering where we stand with ours.
So currently our doses are still in quarantine. They still technically belong to the manufacturer, so pending a determination from Health Canada based on the information coming out of the FDA and other sources, we will, once a determination is made with respect to that which is sitting in Canada, we'll make a determination whether or not those are distributed or whether or not they're returned to the manufacturer. So we look forward to that determination.
Okay, and then I guess going forward, are we expecting that this problem won't emerge with future J&J doses? And also, given how relatively advanced our vaccine program has been now in getting first doses of mRNA vaccines, do we still see the J&J vaccine as playing a big role in Canada's rollout?
Well, it'll be up to the provinces to determine the role for J&J within their vaccination campaigns and within their portfolios. What I can indicate is that we are in the big lift now. So, next week alone, we're planning on bringing into the country 9.5 million doses of mRNA vaccines, and for which we have plans to distribute 5.3 million of those, and rolling over the 4.2 of that second Moderna shipment into the following week. So in the weeks ahead, there is a significant supply of mRNA vaccines to support the provinces and their vaccination campaigns, particularly as they look to advance those second dose strategies. For the territories, we've provided them with sufficient vaccine supply to meet 85% of their eligible populations. And if they need more, we'll ship more so that we can maximize the number of Canadians across the board who are eligible to be vaccinated as we follow Dr. Tam's advice and shoot for the stars.
Thank you. Next question. Question, thank you.
Thank you. Merci. Our next question. La prochaine question, Annie Guillemette de Cogeco Nouvelle 90.
Next question is from Cogeco Nouvelle, 85.9 FN. Please go ahead. Question. I have a question about the delivery schedule. First of all, I'd like to talk about the drop in cases and hospitalizations and the other indicators. What can we say about the third wave? Is it over? Have we now plateaued between two events? What is the current situation according to the charts and that you have, especially if you compare them with other previous waves? Answer. Thank you for the question. This is Dr. New speaking. Perhaps I'll begin. If we look at the epidemic curve with the evidence and data and number of cases reported by provinces and territories, I think the trends are very encouraging. Certainly, we're on the curve is going downwards in this epidemic. And later indicators such as rates of hospitalization, those numbers have also decreased. So those are all good news. But as we've seen previously in our experience between the first and second and then the second and third wave, it's always something you have to keep a close eye on, and we must remain prudent. If we start to open up and lift restrictions and health measures too quickly, we may risk creating a fourth wave. So things are going very well now with our vaccination programs, but we must keep public health measures up. And we have to gradually lift restrictions with a great deal of caution, always keeping an eye on the numbers, the indicators, and the evidence of transmission in communities. We have to make sure that the healthcare workers are safe, and we also have to keep a close eye on the transmission rates, community spread. It's always a priority for public health. But I do think we're in a good situation. I'm not sure about a plateau. I believe that the curve is now moving downwards. And if we keep up with the vaccination and with the current public health measures, I believe the epidemic curve will continue to descend. Thank you. Supplementary question. With respect to the delivery rates, it has over the last weeks and months. When do you think we'll reach the 75%? Will we continue to accumulate doses, as Dr. New was saying, in order to reach, if we hope, 100%? Are we going to need a third dose eventually? We continue to send vaccines to COVAX. Our deliveries are dropping. What's going to happen when we do reach our goals or even go beyond them? answer. Thank you for the question. I can begin to answer, and then Brigadier General Brody may also have her own comments, or Madame Paquette may have comments to add as well. I think the goal has always been to offer full vaccination, meaning 2 doses to all Canadians who are eligible here in Canada. So I think by the end of the summer, perhaps September, we will have done that. I think we are well on the way, and that remains our goal. As I said, we're talking about 75% as a goal, but it's a benchmark. So if we reach 75% of the population that's received at least 1 dose and then 20% with both doses, that is a good signal, a good indicator to begin to gradually decrease some of the public health measures. Everyone in public health is hoping for a higher rate than 75% of the entire population fully vaccinated. That remains our goal. And personally, I hope that we can fully vaccinate 100% of the Canadian population. As Dr. Tam says, let's shoot for the stars, and we're going to keep doing that.
Oui, et comme vous avez
Follow-up question. Yes, and as you said, as you said, the situation continues to evolve. We need to evaluate our future needs, and as you said earlier, that includes the donated vaccines. But there will be further details announced later on that topic. Thank you.
On a fait les rencontres bilatérales la semaine dernière.
We had bilateral meetings with all of the provinces and territories last week. We discussed their capacity to deliver the vaccines in comparison to the quantity of the doses available. It's clear that we have a great deal of capacity to vaccinate, and if we can properly coordinate in order to properly match the availability of vaccines with the capacity to vaccinate in the coming days and weeks and months.
Merci beaucoup.
Thank you.
Question.
La prochaine question, our next question, Mike Lecouteur, Global News. Your line is open. À vous la parole.
Good afternoon. Thanks for taking our questions. I wanted to ask about the donations, and I know that you don't have a lot of information, Madame Paquette, but for you, possibly Dr. Tam and Dr. New in this question, how could it affect our own rollout? I know in French, Dr. New, you seem to mention that you want to make sure that all Canadians get both vaccines before we start donating. Is that the case? Is Canada only going to start donating vaccines to other countries once we hit certain vaccine milestones in our own country?
It's Dr. New. Maybe I can start because you put the question. I think that to be quite honest, I think that there are sort of 2 tracks, but as they say, I think we can walk and chew gum at the same time. The fact is that delivery of vaccines are coming to Canada, and we're well on track to be able to offer the 2 doses of vaccine to every Canadian that's eligible for vaccines. And I think certainly we're looking towards the end of the summer if our planning and the logistics all go well. And at the same time, certainly I think other government officials are obviously in discussions, including obviously our senior political leaders in terms of what Canada could be doing at the global level. So I think in some ways it's not one or the other. It's really I think both things are happening at the same time. So I'll leave it at that, and certainly turn to my colleagues for any additional comments.
I would say that I agree with Dr. New on this, and I just want to reassure you that Canada did secure more than 400 million doses of its of vaccines and vaccine candidates. So we are in a position where this is possible, but we're also I want to just assure you that it will not impact our objective of fully vaccinating all Canadians by the end of September.
No one else wants to weigh in? I can go with a follow-up. take that as a yes. So, Dr. New, you also mentioned timelines of fully vaccinated, and Dr. Tam has talked about shooting for the stars. So based on the numbers of vaccines that we're getting in the country and how quickly we are we looking at changing our goalposts right now and aiming for a 2-dose summer rather than just a 1-dose summer and a 2-dose fall?
It's Dr. New. Maybe I'll start and then certainly turn over to Dr. Tam. I think what you're referring to, I think, is what our Prime Minister said. And I think it's nice, it's simple in terms of what the Canadians can look forward to. But I think, in my view, certainly what we're seeing in the past several weeks, but also what we can look forward to based on the sort of the supplies of a vaccine coming in, and also how provinces and territories are ramping up their vaccination programs. That yes, I think hopefully we can accelerate and have many more Canadians receiving their 2 doses of vaccine. By sort of late summer and maybe even earlier. Who knows? But I would say that one of the things that's still unknown is that it's always easy. You can look at the trends. Okay, everyone's got their 1 dose, and we're going for the 2 doses. But I think, as we talked about earlier, the first 60-70% might be easier to administer the vaccine, and we've seen that experience in other countries. Hopefully, Canada, we're not going to follow those other countries where they were able to vaccinate quite quickly. The 60-70% of the population, and then they start plateauing, because it's always harder that last few percentage points in terms of the part of the population that might be a sort of a more vaccine hesitant, or let's say maybe also in terms of accessibility. So we're looking at that carefully, and we're obviously collectively looking at how we can address issues of accessibility, but also vaccine hesitancy. So I would say that we can't necessarily rely on sort of the good trend up to now, and just expect that it will continue just because we've done so well so far. But certainly, I think that if everything goes according to plan, that hopefully, I would say that, instead of saying, okay, all Canadians might be fully vaccinated by the end of September, hey, if everything goes well, I'm optimistic, maybe it'll be sooner. But like I say, the goal still officially is obviously offering all Canadians their full vaccination by the end of September.
It's Teresa Tam. I would say that we're always trying to be, planning ahead and being precautionary. Of course, we will want the 2-dose faster. But I know that with the provinces and territories, I think all Canadians, it's until Brigadier General Brody gives you the absolute delivery time that people are still, concerned. So I think this is the pattern that we've seen. You can say, well, here's the projected delivery, until you've seen that, spreadsheet with a solid number on it, and actual commitment. We can't say for sure, but based on what we had initially planned for, then it's possible that you could get 2 doses earlier. The other thing, and why I say go beyond the initial modeling estimates for safe opening. That's based on not overwhelming your hospital system, not based on no cases. But it is that if we get variants more transmissible, and if we get variants that evade the vaccine immunity, even by a little bit, it's much better to shoot for higher. In that way, you can be much more reassured that the hospital systems won't be overwhelmed. But because of the Delta variant, I am advising caution, particularly in between the first and second doses in terms of the population coverage. And I totally agree with Dr. New that the last kilometer, well, actually 2 kilometers, if I've ran marathons before, the last 2 is horrible. If you've got to, just keep looking at that finishing line and try as hard as you can to get there, but we know we will. We know we'll cross that finish line. That's what I hope for everyone. But I think part of it is that the variance makes me want to tell people that people should go higher for sure.
I would just add, it has been my life's work to deliver essential supplies to the people that need it at the time and place that they need it. And to do that now with vaccines, with COVID-19 vaccines for Canadians, is really, I think, a tremendous testament to the collective effort that has brought us all to this moment. So if we look now, in the next 2 weeks alone, there'll be over 14 million doses, and we have solid supply projected throughout the month of July. So if we can ask Canadians like now to step up and step forward and do your part in that enterprise to be fully vaccinated as soon as possible, as soon as those schedules allow, then truly this is how we will lead ourselves through this pandemic as Canadians.
Thank you. The next question will be the last. La prochaine question sera la dernière.
Thank you. Merci. The last question, la dernière question, Stephanie Levitz, the Toronto Star. Your line is open. À vous la parole.
Hi, thanks for taking my questions. The first one, Dr. Tam, I wondered if you could just give an update on where Novavax is in the approvals process for Canada.
I actually can't. We don't have the Health Canada colleagues or regulators on, so we will have to get back to you on that answer. Sorry about that.
Okay. And my second question has to do with the ongoing discussions to plan for a rollback of restrictions at the border. Lots of folks seem to be a bit panicky because children under the age of 12 can't currently receive a vaccine. And so there seems to be a lot of concern out there. What's going to happen with kids? Are we going to have to evolve public health guidance for children who can't be vaccinated? They don't have access. Will they have to quarantine? I wonder if you could share, Dr. Tam, some of your thinking, if there is any ongoing, about how to manage that issue as we get further along in the vaccine process.
And you're talking specifically about the border in terms of the
let's focus a bit on the border. Yeah.
So obviously, right now, vaccines. One vaccine's approved for, I guess, youth or adolescents, 12 years or older. Obviously, younger kids can't be vaccinated, and so I think, the first rule of thumb, if you like, is that, of course, kids can't be separated from their parents. The current construct is that anyone who's coming in who has the right to enter Canada will take a pre-departure test. So everyone has to do that. And then the vaccinated individuals are exempt from the government authorized accommodations, knowing that they've been fully vaccinated and have had that pre-departure test. I think if you had minors within a group of families, then I think the current thinking is that they're all then exempt from the government authorized accommodations. And they will then move on to obviously get the arrival test and wait for the results. Now, anyone who is unvaccinated will have to stay in quarantine for longer and get the day 8 test. So there may be some differential protocols for vaccinated and vaccinated group members or in that family. But we'll make sure that those questions and answers are provided. But there is no intention to separate children from their parents, of course. And I do think that children in general have had milder illnesses and have been, at least to this point, seem to be less of a key role in transmission. But we're always watching that really carefully. So that's the current thinking, and we'll have obviously have to answer those detailed questions in the days to come. Does that help?
Thank you.
Yeah, thank you very much.
Thank you, Dr. Tam. That will be all for today's news conference. C'est ce qui met fin à la conférence de presse pour aujourd'hui. Merci d'avoir été avec nous et bonne journée.